International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
I read with interest the editorial of Mariana Fottaki on why and how compassion is necessary to provide good health care. It was a great pleasure for me as an academic physician to comment on it. Mariana Fottaki accepts that compassion is a foundation of ethics, of care in healthcare services organization, and she suggested that caring with compassion could be inculcated through health education by considering the interaction between individual motivation and social structure. My first comment and suggestion was to study further this interrelation between individual motivation and social structure by using the theory of planned behavior with the aim to explore this interrelation as an important determinant of the healthcare practitioner's intention to behave with compassion. Secondly, how to modify the perceived behavior of healthcare practitioners. And thirdly, to what extent we can enhance the intention to behave by providing teaching courses or by establishment of incentive to them. To that direction is still questioning on how we can modify the professional behavior. There are three key questions. By changing the practitioner's belief system towards to a moral dimension of a medical profession, or by intervening in the system of the existing social norms relevant to medical profession, or by convincing them that a new legitimate or incentives-based setting will enhance the performance toward compassion. We need to focus more on cultural change and discuss how we can achieve it within the existing healthcare organization. Do you attempt to involve more patients in issues relevant to quality of care and patient safety, or by assigning additional responsibilities to both policymakers and leaders or managers in healthcare organizations? Mariana Fottaki agrees that the provision of adequate training could be effective only if it is followed by specific measures and policies. It is well accepted. However, what do the authors mean by saying adequate training? To what extent this statement refers to undergraduate medical education and vocational training? Although the question to what extent compassion can be taught and how it can be taught needs a further attention and evidence, there are some positive signals from initiatives already experienced and gained from Europe, including that one from Crete. With all of those to our mind, we could agree with Mariana Fottaki's statements that we need specific measures and policies to foster compassionate care, and financial incentives seems to not be the ideal and effective solution. In addition to the author's clear statements, we needed also, firstly, to look beyond individuals and explore the impact of social groups and cultures, and to see and explore and study the magnitude of a culture and a social-based approach. Having all of those in mind, and in conclusion, it is clear to me that compassion induces an important impact on clinical practice, and its necessity is more profound in a period of economic crisis. Professional values and healthcare services should be reconsidered towards to the development of a more patient-centered integrated and compassionate healthcare system.